Hello everyone, my name is Dr. Samara White and I'm a pharmacy resident at Buffalo Psychiatric Center. Today we're going to be talking about diabetes. So to talk about diabetes, first we're going to discuss how the body typically uses glucose and insulin. We're going to discuss what diabetes is, how it can be prevented, how it can be treated, and then a couple of other things about diabetes medications. So when we eat or drink foods that have carbohydrates, also known as carbs, your body breaks them down into something called glucose, which is a type of sugar. This glucose then goes into the bloodstream and raises the level of sugar in your blood. Once the pancreas senses this, it releases insulin, and it does this in order to move glucose from the bloodstream into cells and tissues where the body can use it for energy. Diabetes is a chronic condition where there's a high amount of sugar in the blood. Basically, this happens because there are issues with insulin, and because of this, glucose is not transferred into the body's cells, and therefore the body cannot use it for energy. Instead, the glucose accumulates in the bloodstream, leading to the high levels of blood sugar that we talked about. There are two different types of diabetes, type 1 and type 2. In type 1 diabetes, the immune system attacks the pancreas, and the pancreas is no longer able to produce insulin. This is what's known as an autoimmune disorder, and this has nothing to do with a person's diet. Whereas with type 2 diabetes, due to poor nutrition, the body cells don't respond well to insulin and can't easily move the glucose from the blood into the cells where they can be used for energy. Since the body is less effective at using insulin to decrease blood sugar, this is referred to as insulin resistance. Over time, the body requires more and more insulin to help control the blood sugar, and eventually the pancreas is unable to keep up. Regardless of the mechanism, in type 1 and type 2 diabetes, the glucose accumulates in the bloodstream and there are high blood sugar levels. Type 2 diabetes is more common than type 1 diabetes, and it usually occurs later in life because insulin resistance occurs with having poor nutritional habits for a long time. However, we are starting to see this trend in younger populations, now even as early as in childhood. The symptoms of diabetes result from high levels of sugar. The kidneys try to remove the glucose from the body by increasing urination. Because of the increased urination, the body is more easily dehydrated. So this prompts a person to drink more, and the cycle continues over and over with increased thirst, urination, and dehydration. The dehydration also contributes to dry skin. And because the body can't convert the glucose into energy, people often feel fatigued and tired. The body tries to correct these low levels of energy by making the person feel hungry so that they eat more food for energy. But unfortunately, eating doesn't give the person more energy or make the hunger go away. Instead, it just contributes to the already high levels of blood sugar. High blood sugar can also cause parts of the eyes to swell, leading to blurry vision. It can even damage nerves, causing tingling sensations or even numbness. High blood sugar also causes poor blood circulation because over time it causes blood vessels to constrict. The poor blood circulation can decrease a person's immune system functioning and cause slow wound healing. And this is unfortunate because at the same time, glucose feeds bacteria, which tends to increase infections. And since immunity is already decreased, these infections can become very hard to manage. Symptoms of diabetes can get out of control when they are not managed, and they can go on to cause more severe complications. As you can see, all of these complications relate to the symptoms from the last slide. Since the kidneys work extra hard to try and eliminate the glucose, This can cause kidney injury. The blood vessel constriction from high blood sugar leads to high blood pressure, heart disease, stroke, and increased cholesterol. The nerve damage paired with the increased infections can become so severe that amputation becomes necessary. This is especially true of the feet, and people with diabetes should check their feet daily for any ulcers and wounds. In order to manage diabetes, we must first know how high the sugar is in the body. There are two blood tests that we use to monitor diabetes, and the result will determine what modifications need to be made to the medication regimens. The first test is blood glucose. This measures the current levels of blood sugar in the body and can be done if the person is fasting or if they've already ate. The second test is known as A1C. It's also known as hemoglobin A1C, or abbreviated HbA1c. This test measures blood sugar as an average over the last 3 months. And unlike the blood glucose test, eating before the test does not affect the levels. These are the two most popular ways of measuring blood glucose. The first one, you prick your finger with a device to get a drop of blood, and then apply the drop of blood to a testing strip. The second one is a device that continuously monitors your blood glucose without you having to prick your finger every time. This one is known as continuous blood glucose monitoring. This table shows the requirements to diagnose diabetes. In order to diagnose diabetes, a person's A1C must be at least 6.5%. As far as the blood glucose levels, if the person was testing before a meal, it must be above 126. If it was after a meal, it must be above 200. And we can compare these to the normal levels seen on the left-hand side. An A1C that is normal is below 5.7%. A blood glucose before meals is below 100, and a blood glucose after meals is below 140. This slide looks similar to the last one, but these goals are for people who have already been diagnosed with diabetes. For these people, their goal A1C is below 7%. Their goal blood glucose before meals should be in the range of 80 to 130, and their blood glucose after meals should be below 180. Depending on a person's age and past medical history, including heart attacks or strokes, or even pregnancy, their goals may be different. Now that we understand the basic principles of diabetes, we can now talk about preventing and managing diabetes. The first step is a very important step, and that is lifestyle modifications through non-pharmacologic methods. This means things outside of medications. Some examples of non-pharmacologic methods are exercise or physical activity, paying attention to nutritional habits, as well as weight loss and smoking cessation strategies. These non-pharmacologic strategies can help to prevent diabetes, or if someone is already diagnosed with diabetes, can decrease the number of medications that a person has to take. And more importantly, these lifestyle modifications can help prevent the potentially irreversible complications of diabetes that we spoke about before. There are a couple of goals that everyone should follow, no matter if you are trying to prevent or if you are trying to manage diabetes. For exercise, people should aim to get at least 150 minutes per week of moderate intensity aerobic activity. These are things such as walking, jogging, swimming, biking, etc. Anything that gets your heart rate up. This may seem like a lot, but this breaks down to 30 minutes a day, 5 days a week. And this makes this goal seem much more attainable. People should also aim to incorporate resistance training, which is using weights, 2 to 3 times per week. In addition, another feasible goal is to decrease sedentary habits, such as sitting or laying down for too long each day. Even walking a little bit every day goes a long way. As far as nutritional goals, people should try to decrease the amount of food or drinks they consume that are high in processed sugars, carbohydrates, and unhealthy fats. These are things such as soda, chips, candy, and fried or fast foods. Instead of these foods, people should try to increase the amount of vegetables, fruits, whole grains, and lean meats such as fish, chicken, turkey, or low-fat beef. The changes that people make don't have to be drastic or all at once. In fact, this can make it hard to stick with these changes. Instead, gradually changing your habits can help make these lifestyle modifications easier and last even longer. As far as medications that can be used to manage diabetes, it depends on the type of diabetes that you have. For type 1 diabetes, since the body cannot make insulin, we treat this by giving insulin. For type 2 diabetes, there are a couple of different options, including oral and other injectable medications. Here's a list of the oral diabetes medications that are available. I know this table seems a little bit overwhelming, but we'll go through it step by step. The first medication class is called biguanides. The example medication is metformin. And this works because we can get sugar by a couple of ways. One, by eating foods with carbohydrates, or two, the liver makes glucose when we're not eating foods. Biguanides stop the liver from making glucose in the first place. Biguanides have a lot of stomach issues that can be associated with them. These include nausea, vomiting, diarrhea, indigestion, stomach pain, and even flatulence, also known as gas. These can be helped by taking the extended release version of metformin instead of the immediate release version. It can also help to take metformin with food. Some other side effects may be vitamin B12 deficiency or weight loss, which can be a good thing since weight loss helps with managing diabetes. The next class of medications are called SGLT2 inhibitors. Basically, these work by helping the kidneys get rid of glucose through urine. Some example medications of these are Jardiance, Farxiga, and Invokana. Since these medications help the kidneys get rid of glucose by urination, a couple of the side effects are related to that. So with this class, we see increased risk of urinary tract infections, increased urination, dehydration, which can also lead to low blood pressure, also low blood sugar, also known as hypoglycemia, as well as some kidney issues. The next class of medication are known as DPP4 inhibitors, and these work by increasing the amount of insulin in the body by stopping the enzyme that usually prevents insulin from being made. Some example medications of this class are linagliptin and sitagliptin. This list of side effects may seem like a lot, but keep in mind that not all of these side effects happen to everyone. These are just possible side effects. These include hypoglycemia, which again is low blood sugar, joint pain, increased infections, headache, skin reactions or rash, abdominal pain, and some very rare ones such as pancreatitis, kidney problems, or heart failure. This next class of medications has a very complicated name called thiazolidinediones, but we will just abbreviate these TZDs. TZDs increase insulin sensitivity and help the body use glucose as energy. These include medications such as pioglitazone and rosiglitazone. Some possible side effects of these medications are hypoglycemia, bloating or diarrhea, headache, weight gain, and infections, and a very low risk of bone fractures, liver problems, and heart failure. Our next class of medications are called sulfonylureas. These stimulate the pancreas to make more insulin. These are medications such as glipizide, glimepiride, and glyburide. These may also cause nausea and vomiting or stomach issues, hypoglycemia, weight gain, and dizziness or headache. The last class of oral medications are called GLP-1 agonists. These increase the amount of insulin that is made and can prevent glucose from going into the bloodstream in the first place. These are medications such as semaglutide, and they are also available in injectable form. The injectable form of GLP-1 agonists also include semaglutide, dulaglutide, zenatide, liraglutide, and Mounjaro. Some possible side effects with these medications include nausea, vomiting, and diarrhea, hypoglycemia, weight loss, and injection site reactions if you're using the injectable formulation, and very rarely they can cause kidney problems or pancreatitis. Insulins are some of the most well-known diabetes medications. They are broken up by how quickly they act. For rapid acting and short acting, we have insulin such as Novolog, Humalog, Humulin R, and Novolin R. And these insulins are usually taken at or before mealtimes in order to control fluctuations in blood sugar levels from food. Because of this, these are known as prandial or mealtime insulins. We also have long-acting and ultra-long-acting insulins. And these insulins keep blood glucose stable in between meals and also overnight. They are also known as basal insulins. Sometimes basal insulins can be used at lower doses as mealtime insulins. Some possible side effects with insulin are weight gain, hypoglycemia, headache, diarrhea, and injection site reactions. You may have noticed that a very common side effect of the medications that we just discussed was hypoglycemia, or low blood sugar. This can happen especially if multiple classes of medications are used at the same time, or if we use a medication, especially insulin, and then don't eat. The insulin can overcorrect our blood glucose levels and drop them. Hypoglycemia is a very serious condition when it is severe. It can even lead to seizures and comas if not addressed in time. In order to avoid this, it is important to make sure your blood glucose levels remain above 70. If they dip down below 54, this is severe hypoglycemia and it is an emergency. Some symptoms of hypoglycemia are nervousness, irritability, or confusion, dizziness, drowsiness, or feeling faint, heart palpitations, or increased heart rate or blood pressure. And you should know that some medications, such as beta blockers, can mask these symptoms. Other symptoms are hunger, nausea, sweating, pale skin, and blurred vision. In order to treat hypoglycemia, we use something called the 15-15 rule, which is basically if your blood glucose level is below 70, you should eat or drink 15 grams of carbohydrates and then recheck your level after 15 minutes. If your level is still below 70 after 15 minutes, you should have another 15 grams of carbs. Make sure to repeat these steps until your blood glucose level is at least 70. And once your blood glucose is back to normal, make sure to keep monitoring it and eat a meal or snack if necessary to make sure that it doesn't drop again. Some good sources for 15 grams of carbohydrates are 3 to 4 glucose tablets, a 15-gram tube of glucose gel, half a cup of juice or regular soda, Make sure that it's not diet soda because this doesn't have enough sugar. 1 tablespoon of sugar, honey, or corn syrup, hard candies, jelly beans, or gumdrops, and there's also a prescription medication called glucagon. Before we wrap up for the day, there are a couple of other important things that you should be aware of when managing diabetes. Number 1, it is very important to keep track of your blood glucose levels, and you can do this by keeping a journal or a notebook. It's important to do this to make sure that your blood glucose levels stay within range, and that means not going too high or too low. And this can help us tailor your medication regimens in order to avoid these fluctuations and to keep your levels steady. Make sure to keep note of if you took these levels before or after you ate, since food can affect these levels. Generally, you should aim to always take your levels before you eat, but it's okay if you don't. Just make sure to document it. Secondly, adherence, which means taking your medications as directed, is also very important because, as we discussed before, unmanaged diabetes can have very severe consequences or complications, and some of these may even be irreversible. So this is another reason why it's very important to keep track of your blood glucose levels and to make sure that you take your medications as directed. One of the complications that we spoke about before were foot ulcers. I briefly mentioned this before, but I want to emphasize it again. If you have diabetes, you should check your feet daily for any ulcers, wounds, swelling, sores or blisters, any tingling or numbness, or any other abnormal change to the skin or nails of the feet. It's important to do this because wounds are harder to treat when someone has high blood glucose, and so infections can get out of hand and eventually can lead to amputation if not caught early enough. It's also important to make sure to practice good foot hygiene by making sure you keep your feet clean and moisturized. Something that you may not know is that stress can increase blood glucose levels. So it's important to practice self-care and find ways that you can de-stress. This may be doing things such as yoga, mindfulness, journaling, or even going on walks. And finally, one last complication of diabetes that you should be aware of is something called diabetic ketoacidosis, abbreviated DKA. This is a very serious condition that happens when the body cannot use glucose for energy and has to use fats instead. When the body breaks down fat, it can leave the blood very acidic, and this is a potentially life-threatening emergency. Some general signs of DKA are confusion, nausea, vomiting, stomach pain, and weakness, but one unique sign of DKA is a fruity breath. So if you ever have extremely high blood glucose levels, above around 250, and you notice that your breath smells like fruit, even when you haven't ate or drank anything that would cause this, make sure you tell your healthcare provider right away. Before we finish for the day, we'll just go through a couple of quick wrap-up questions to make sure you understood the most important concepts from today. Number 1, what does insulin do? A, causes diabetes. B, decreases the amount of glucose in the pancreas. C, helps glucose to be used as energy. Or D, increases the amount of glucose in the blood. The correct answer is B. Insulin helps glucose to be used as energy. Remember, it does this by transporting glucose from the bloodstream and into the body's cells where it can be used as fuel. By doing this, insulin helps to decrease blood glucose levels. Number 2, true or false? Type 2 diabetes can be prevented by good nutritional habits and physical activity. A, true. B, false. The correct answer is A, true. Remember, it's important to try and get at least 150 minutes per week of aerobic activity, such as walking, jogging, or biking, and it's important to try to increase the amount of fruits, vegetables, and lean meats in your diet. Number 3, which of the following is true regarding A1C? A, it can only be measured when fasting or not eating. B, it is an average measure of blood glucose over the last 3 months. C, it has nothing to do with diabetes. Or D, a higher A1C is better than a lower A1C. The correct answer is B. A1C is an average measure of blood glucose over the past 3 months. And remember, a lower A1C is better than a higher A1C. Number 4, which of the following is true regarding short or rapid-acting insulin? A, they are usually dosed once daily. B, they are also known as basal insulin. C, they are interchangeable with long-acting insulins. Or D, they are usually used before or with meals. The correct answer is D. They are usually used before or with meals. This is why short-acting or rapid-acting insulins are also called prandial or mealtime insulins. Number 5, true or false? Hypoglycemia, low blood sugar, is not dangerous. A, true, or B, false? The correct answer is B, false. Remember, hypoglycemia, especially when the levels drop below 54, are extremely dangerous and can lead to seizures and even coma. And lastly, number 6. Which of the following describes the 15-15 rule of hypoglycemia? A, you should take 15 grams of carbs and recheck your blood glucose after 15 minutes. B, hypoglycemia occurs when blood glucose is below 15. C, there are 15 symptoms of hypoglycemia. Or D, you should give 15 units of insulin to treat hypoglycemia. The correct answer is A. In order to treat hypoglycemia, you should take 15 grams of carbs and then recheck your blood glucose levels after 15 minutes. And remember, the goal is to be above 70. Thank you so much for joining me today to talk about diabetes. If you have any questions, please make sure to contact your pharmacist or physician. Have a great day.